Intellijoint Hip Direct Anterior Approach Application provides surgeons with intraoperative measurements for cut position, leg length, and offset. Make 2 small stab incisions on the iliac crest. Insert self-tapping screws into the pelvis and slide the pelvic platform onto the pelvic screws. A magnetic mount is used to attach the camera to the pelvic platform. Create a repeatable mark at the knee. Install the femoral disc on the anterior lateral aspect of the greater trochanter. Register the interasus line by placing the probe and tracker on a point over the patient's skin that defines the left asus. Repeat these steps for the right asus. Registration is now complete. Using the probe and tracker, capture the baseline leg length and offset by tracing the femoral disc groove. Continue with the surgical workflow. Intellijoint Hip provides accurate real-time anteversion and inclination angles while accounting for any intraoperative patient movement. Position the cup as desired. Perform the first trial reduction. Relocate the femur and use the probe and tracker to capture the new leg length and offset by tracing the femoral disc groove. Touch the repeatable mark at the knee. Reproducing the original leg position is not required to obtain accurate leg length and offset measurements. The measurements are independent of the leg's orientation. Intellijoint Hip Anterior will display changes in leg length and offset values for each trial reduction. Perform additional trial reductions. Each trial measurement is saved in the software. All final values, including the final cut position and final leg length and offset, are saved to a summary screen. Intellijoint Hip Anterior. Intraoperative measurements for cut position, leg length, and offset. Visit IntellijointSurgical.com for more information.